here. Hope you all are enjoying life and doing wonderful. So today I am here to talk about three very common terminology or phrase that we are using on a daily basis. Not that we are using those terminology on a regular basis. Actually, we are hearing those through different media, through our healthcare authorities. So I would like to discuss just to see if we can figure out what are the similarities and what are the differences, and why these processes are actually in place to prevent and control the spread of COVID-19 during this time of pandemic situation. So these three terms are isolation, quarantine, and social distancing. Isolation separates the ill individual from others who are not sick. The purpose of isolation is to prevent spread of infectious agent or virus from ill individual to others. One of the important things to understand that isolation will be successful if we can detect the case as early as possible. So we have to have a process to identify the case as early as possible so that we don't miss the days or time when case actually become infectious and spread the infection to others. So what is quarantine? Quarantine is applicable to a person who is a contact of a positive person or case, or who has a history of exposure with the case. Sometimes a person will be assumed to be a contact person or got exposed based on the situation they faced or the place where they are coming from. For example, an international traveler traveling from one country to another country during this pandemic situation need to face or follow the quarantine requirement for the traveling country. So quarantine actually applicable to a person who got exposed but not yet ill. That person is will be followed up during the quarantine to see whether they actually become sick from the exposure. So they have to be isolated 14 days at the location where they are following the quarantine. It could be their home or other places. So the isolation won't be able to detect a person who is actually ill and asymptomatic, because we put people in isolation when they become ill, but quarantine actually covering up that part, because we actually putting people in quarantine when they are not sick and they are actually monitoring every day to see whether they become ill from the exposure. By the process of quarantine, actually we are trying to identify an individual at the very early dates of their onset. Even before they become ill, they are isolated so that there is a possibility of transmission of the disease is very slim if they follow the quarantine mechanism properly. But quarantine may put a not ill person in isolation, so that person this person need to get support from the authority who are putting them in quarantine. For example, if they lost the work days, then they should get compensation, and they should get support in case they don't have the quarantine facility. If somebody violate the quarantine law, they will face the consequences such as penalty or fine. Identification of case and early contact tracing is also important to get result from quarantine process. Community containment or community-wide intervention is one of the important and additional intervention for pandemic situation. During COVID-19 pandemic, during this time we are seeing that many community, country and geographical region, they apply different community intervention that affect the entire community of the country. It also depends on the current situation of that particular country or the region. It also depends on the daily surveillance report, and if we think about the epi curve, then whether the curve is flattening or not, or also it depends on definitive treatment or vaccine availability. Until we have definitive treatment and the vaccine for this particular disease, COVID-19, some sorts of community intervention will be in place to prevent another wave or surge of cases in a particular region. Community intervention or community containment has a different spectrum. In some region we saw that the complete city or the region were shut down. Then it may start with very rigorous and strict measures, and gradually some of the measures can be lifted, so that it all depends on the current situation of the pandemic or the outbreak. Social distancing is one of the good example. For example, closure of the schools and telemedicine, teleworking, working from home, closure of the daycares. These are the some of the example of community containment. If we compare isolation and quarantine to community containment, we have to say the purpose of community containment is preventing interaction and movement of everyone in the community, to prevent non-identified infectious people to be in close contact with the healthy people. By doing a balanced approach and rigorous measures, we trying to ensure that lots of susceptible individuals who are not yet sick do not come in contact with infected individuals. One of the good example is social distancing. As you know that we are following the 6 feet distance. And another example is universal masking at some healthcare setting. Laws or bylaws that require public to wear masks in the public places. Need to. These are the example of community containment. So that was the end of my the discussion today. All three processes have significant impact during the time of COVID pandemic. Hope viewers you like my discussion, and in future I will come back with a new topic. Thank you, and you have a great time.